Great. Good morning and welcome to Franklin Tomorrow's Frank Talks. We're so glad to be with you. It is Monday, January 11th, and I'm Mindy Tate, Executive Director of Franklin Tomorrow. And it's 2021. In case you have slept through the last 11 days or just not wanted to admit it, today is January 11th. And we got with us for most nonprofits, many nonprofits operate on a calendar year, as does Franklin Tomorrow. And so this morning, I'd like to welcome our new board president, Patrick Baggett. Good morning, Patrick.
Good morning. Welcome everyone to 2021 and our first monthly Frank Talks event. We appreciate everyone who's attending virtually and watching on Facebook Live and YouTube TV and all the other channels where we publish these events. We appreciate everyone's continued support as we continue to navigate through the pandemic, and we do anticipate to continue hosting these events virtually. But today, we would like to thank specifically Renaissance Bank, Diane LeBlanc and Tony Sharp, who are here, and you'll hear from them here in shortly. But also, we'd like to thank Williamson Medical, one of our premier sponsors for Franklin Tomorrow and Frank Talks. Both Renaissance Bank and Williamson Medical Center both are such key partners in the community, but also with Franklin Tomorrow through this programming. And really, we couldn't do this without you. And what you do matters. And I think events like this and others that we put on are really the proof. So thanks everybody. Welcome to Frank Talks, and look forward to this program.
So Patrick, you've been on our board a couple years, but you're stepping into this new role, and we'll be talking a little bit more about that in a special video this week on our Facebook page and on our website, right?
That's right. Yep, we're going to put that out later this week, so everyone look for that.
Great. Thanks so much. And thanks again to Williamson Medical Center and Renaissance Bank. And as Patrick mentioned, we have Diane LeBlanc and Tony Sharp with us from the Columbia Avenue branch of Renaissance Bank. Good morning, guys. Did y'all trudge through the snow and get to work? It's good to see that.
We did. Good morning. And thanks so much for being awake and ready and not out in the snow. But we are excited to be here, and again, continuing our partnership with Franklin Tomorrow and especially Frank Talks. It's going to be a new year, 2021. We did turn those calendars over, and we're ready to wash away 2020 for sure here at the bank. We have our doors open in all of our lobbies. Here at 815 Columbia Avenue, you can come on in and see us. We will, of course, wear our masks and social distance, but we are here to serve you. We're looking forward to sharing more information. I know a lot of small businesses are thinking about the PPP, and we are waiting for further guidance at this point from the SBA on how that's going to roll out that round two. There are some smaller community financial institutions that are able to go ahead and start accepting applications, we understand, this week, but we are not to that point. We are still waiting on further guidance. So I suspect most banks here in our community are in that same position, but we're looking forward to, again, helping many small businesses to help them keep their doors open and keep things going. I've asked Tony Sharp, our branch manager here at the Franklin office, to share some information on savings. As we think about the new year, we're talking about, how do we need to prepare for 2021? And I've asked Tony to share some of that information with you this morning. He's going to share his screen and do that.
Yeah,
Tony?
Good morning. Thank you, Diane. And good morning, everybody. If 2020 taught us anything, it was it kind of got us in check about a lot of things going on within our lives, and one of those is our finances. So many Americans nowadays, you either struggled with either keeping your job or having to spend more money because, well, some of us got bored in our homes all day, and we had to figure out ways to entertain ourselves. And going into 2021, you know, with it being a new year, people, you know, have different mindset now versus what they did in 2020. So there was a survey done that 73% of Americans have a goal or a New Year's resolution, if you will, to be smarter with their money. And I know I'm one of those, and you know, there's always the diet and there's travel more, but definitely money is always top of mind, especially when you live and work in the banking world. And there's, you know, the top 5 things that Americans typically want to overhaul in their finances is 1, getting out of debt, removing unnecessary bills. Maybe you have 7 subscription services and you got one to watch that one show, and now it's time to start consolidating back to those, you know, normalcies, and just spending money more wisely on how you, whether it's eating out or eating from home, and then seeking out more deals with coupons and smarter shopping. And then another top piece was saving money by using an app. There's several apps out there that you can use. One of the things I want to talk about real quick before I turn it over, we have some tools on our website that you can go to. This is just kind of, when you talk about savings, is like, where do I even start? Where do I begin? And, you know, we can help you with that here if you're not sure or you need some help. Is kind of the 50-30-20 rule. And it's kind of broken down into a few pieces, which, you know, 50% is based on your needs, 30% based on wants, and 20% for long-term savings. And it kind of breaks down for your needs, or those are your fixed payments, your mortgage, your car payments, your utility bills, all those things that you pay the same amount. Then you have your wants, or your discretionary spending, and how you should save for those. Those items can include entertainment, cosmetics, books, music subscription, Amazon Prime membership, even your food. And some people would say food might be a need because we need food, but the food can be a discretionary piece because you can change how those habits go. And then the 20%, obviously this might be the most important piece, is saving for your income should go into long-term savings and how you plan to prepare for the future. It's never too late to start saving, no matter how old you are or how young you are, it doesn't matter. I shouldn't say old, maybe seasoned. I should use that word, seasoned, how seasoned you are. So I feel pretty seasoned. So 20% of that. And then a good rule of thumb is 3 to 6 months of savings in case you do lose your job or you do have those unwanted expenses, is always a great tool. The next thing I just want to share on our website is we have tools, so many different calculators that you can go to. And if you have a goal that you want to save $50,000 and and so depending on how many years you have that goal, our calculator can do that for you and tell you how much you have based on how many you currently have saved, how much you plan on saving, and then you can just calculate that. You can also include an inflation rate based on the national average of 2.9. So we have a lot of great tools. This right here says if I put $200 a month in, I will not hit my savings goal in 5 years, but I need to be saving $660 a month to save $50,000. So just want to share that out there. If you need help, we're here to help you out and get you in the right direction for 2021.
And Tony, how did they find that? How do you get to that savings goal calculator?
You just simply go to our website under personal. You have calculators right there, and you can just go in there. And there's so many other things. If you want to pay off your mortgage early, there's one here to tell you how to pay off your mortgage early, and it amortizes your payment schedule on when it would pay off based on how much you pay per month. There's debt consolidation calculators and so many different things. So thank you guys so much.
That's great advice for the beginning of a new year, and we really appreciate that. And we've sent out the link to the information on the Renaissance Bank website on the 50-30-20, and we can direct people to you if they need more information. But thank you. It's great to see, and it does make us stop and think. And those wants, needs, and luxuries did sort of change in 2020, but maybe we can focus back in 2021 a little bit. It's going to be a challenge because we're still home, and so we'll see how that goes. But thank you all so much, and have a great day. Also with us this morning, we have Nicole Volk, who's the marketing director for Williamson Medical Center. And Nicole, how are you doing this morning? Oops, I can't hear you. It says you're connecting. Great. There, I can hear you now, I think.
Hear me now?
Yes, great.
Great. Can you still hear me?
Yes.
Okay, wonderful. Sorry about that. Doing great on this snowy Monday morning. Happy New Year, Medical Center. We have Dr. Russell here, our Chief Medical Officer. We're excited that he has joined us, and he's going to be giving us just an update on what's going on at Williamson Medical Center and kind of what to look forward to this year.
Great. Well,
So
we'll hear from
look
him in a
forward-
few minutes. And on this snowy day, you're at home? You've got a lot of great Spartans and memorabilia there behind you. What's that collection you've got there?
Can you tell my husband went to Michigan State? Yes, I'm upstairs hiding from everyone in my home because the kids are home, everyone's here. So I escaped to upstairs to his man cave area, and I thought we would show off all of our Spartans memorabilia.
Well, great backdrop. She's going to win the prize today, I think, almost, guys. I'm not sure. Matt, I know you're going to be jealous, and you all can try to lobby to see if you win, but so far Nicole is killing it, I think. Thanks,
Awesome.
Nicole. We'll
Thank
hear from Dr.
you.
Russell in just a bit. So,
Wonderful.
Patrick, I know you've got that Franklin Rodeo banner behind you. So.
Yeah, I was just kind of easing over, so maybe I'd be in the running, but no, that's a vintage City of Franklin Rodeo banner there that Michael D'Amico put up when the city changed out their banners. We got those. So anyway.
Well,
Maybe
mine's kind of boring. I'm kind of
honorable
feeling like
mention.
Chris and I have the same decorator today. I'm kind of feeling, but we'll get to you, Chris. We'll stop picking on you. I might change my backdrop while we do that though, so I don't have a boring one. Well, it's 2021, start of a new year, and we've got Mayor Ken Moore with us. Mayor Moore is in his office, and he's got a backdrop too, but we'll just let him be. But Mayor, it's 2021. Are you excited about a new year? Are you looking forward to what's to come this year? And what are some of those things that are ahead of us for 2021?
Well, thank you, Mindy. And this is such a great opportunity for our community to learn what's going on, particularly what to look forward to. And I don't really want to talk about 2020, but I do need to mention that because a lot of the financial tools that we have, we ended up in pretty good position last fiscal year. In fact, we were $14,000 to the good. We've had no loss of services, and we've had no layoffs. So I think that's really good news for 2020. There's a lot of other things I could talk about, but I really want to talk about 2021. And not always, but frequently at the top of my list is Mac Hatcher. That continues to move along very well. Next in 2022, our upgrades to our water reclamation facility will be done. We're looking at starting soon to acquire right-of-way from McEwen Phase 4. We've approved the infrastructure necessary to start the Southeast Park. Franklin Road, if you drive into Franklin, you may have been held up a little bit. That project's moving along, and we've actually incentivized that contractor to get it done early. We look forward to a bridge going across the Harpeth River to the farm at Harlansdale, the park at Harlansdale Farm. We're looking at the 96 West sidewalk for more connectivity. We'll be continuing to finish out the planning for the infrastructure for Columbia Avenue. And I also have on that list City Hall. We've allocated about $800,000 to start studying what's necessary to build a new City Hall where we're at. Fire Station 7 is almost complete. As far as engineering, I've been talking about adaptive signal control for some time, and that looks like it's finally going to get finished this year. And then we continue to design Long Lane. I think we have a lot of momentum as a city. and primarily because we've planned long-term, not only with our projects, but how we're going to match our funding with them. I think 2021 is, I look at it as a great year of opportunity. Certainly the pandemic has crushed our hospitality industry. It's made a lot of changes in healthcare, and I think there's a lot of opportunity that exists there. It's exciting that we have a vaccine. I'm on a call about 3 times a week about which part of those calls include talking about the vaccine, and we're eager for us to be able to get the supplies we need. So far, they've been short in supply, and I would urge people to go to the county website where there's several banners there that you can click on that give you the information on how you can register to get on the waiting list for an immunization. Those procedures are pretty well outlined there, and I'm sure Andy may mention something about that also. To close, one of my preacher friends recently posted this, and it was about social media. And he said, we need to remember that social media platforms are nothing more than privately owned advertising corporations. And they exist to sell things, period. And he advised, don't make the mistake of looking for truth and meaning of life on social media. And I mention this right now because we are at a divisive time in our country. There's a lot of opinions floating around out there. I'm concerned that we're putting things on social media that we would never say to each other. And so I'm hoping that people can tone down that rhetoric and let's work together for a stronger 2021 and a more meaningful 2021 to all of us. I know that this has been a very stressful time as far as mental health, and I don't think that some of the things that I've seen on social media are going to help anybody's mental health at this point in time. So I'm going to suggest that somehow or other we work out a day or a week in Williamson County and the cities in Williamson County where we have a moratorium on using social media and see what happens. I don't think any of us will go into delirium tremors or any of those withdrawal type things if we quit using it for a day and try to use that energy for something else positive. So I wish everybody a happy 2021, and let's move forward and work together. And thanks for everybody being on today.
Are you suggesting that we might actually speak to each other in person? I mean, come on now. That's so.
I'm an old fuddy-duddy, aren't I? Yeah.
We're certainly looking forward to the day when we can speak to each other in person and be together. I mean, that's, I think, as you know, and you have supported us, that's the mission of Franklin Tomorrow, is to engage the community and foster collaboration and come together. And so we are looking forward. We've got 75 people joined us this morning on Zoom here and more on Facebook, but we'd love to have those 75 people together in a room and be sharing a cup of coffee and looking each other in the eye, because it does promote civility through civic engagement, and that's important.
And I definitely applaud Franklin Tomorrow and love working with Franklin Tomorrow because of the things you are promoting. Promoting our community, promoting people in our community, and the civility is a great thing to continue to look at.
I've got my All-America City pin on, Mayor, so.
I started to go through all those positive things about 2020, and certainly being named an All-American City and that partnership we had with Franklin Tomorrow, the city, to help make that happen. And of course, we made Money Magazine's top 10 list again in several categories. So we're really blessed as a community.
I know we have to get off this, you have to get off this call for another call, But we're going to have Matt Largent on later to talk about business and maybe a little bit about this hospitality industry as well. I know that's something you're concerned about because it has been beneficial to Franklin in the past, correct?
Absolutely. I think we're the 7th top tourist destination in the state of Tennessee. And this is a hard number to believe, but tourists spend $1.3 million a day in Williamson County when the industry is healthy. And so we're eager to get back to that. And one of the most important things that we can do as a community is show that we have a safe place for people to come. And that means that we're doing the appropriate masking, facial coverings, and all those other things that absolutely, all those other things are important for us to prevent spread of COVID.
Well, thank you for your time this morning, and thank you for your leadership in our city. We are in a better spot because of your leadership and that of the Board of Mayor and Aldermen and city staff, and we really appreciate you all for the strong leadership you provided during this difficult time. And now we're ready for 2021 and a better year.
Absolutely.
Thanks so much, Mayor. You have a great day.
Thank you. I'll improve my backdrop for next time.
Thank you. So Dr. Andy Russell, the Chief Medical Officer for Williamson Medical Center, welcome this morning. You've got a picture behind you too, so we're showing your headshot and your kind of calling card there. Welcome to Frank Talks. You've been with us before, and we're so glad that you can come and talk a little bit about 2021 and the current times, but also perhaps what's ahead for 2021 in terms of health and mental health, as well as mental health. So how are things this morning for Williamson Medical Center?
Well, the hospital is busy as always, but that's not a bad thing. We're just trying to get through and provide the best care that we can for all of our patients. Mandy, I do want to thank you for asking me to participate in this event this morning. And I'd like to start by just giving you a brief review of the healthcare environment of the city and county in 2020, and hope that'll kind of set the stage as we move into what we expect to happen in 2021. Of course, as the year started, we soon learned of the new coronavirus that was spreading throughout China and then to New York and then the rest of the country. As we knew that it was in the US, the hospital really started making preparations to deal with this as we fully expected it to make its way to us at some point. And on March 5th, we learned that COVID had finally reached Williamson County when our first patient was diagnosed with this new coronavirus. And so starting in early March, during this initial wave of COVID infections, we were constantly undergoing lots of talks and discussions about how do we prepare for this. We thought we really had it bad. I think our peak in March and April, we were up to like 15 COVID patients in the hospital at any one time. And we were fortunate that was all it was, but at the same time, we thought, oh, this is a whole lot of these COVID patients. We were constantly writing guidelines and policies, and it seems like every few days we're learning more information about how to care for these patients, and then we're having to go back and rewrite these same guidelines and policies. We did quite a bit of construction at the hospital to make additional rooms where we could house the COVID patients, how we could keep them isolated from other areas of the hospital. And again, it was just it's still a constant learning process every day about how to provide the best care for these patients and also how to keep our staff safe and healthy. We did see a lull in the COVID census through May and June as Governor Lee's stay-at-home order helped to keep the numbers down. But once that was lifted there at the end of June, our numbers started rising again through July. And unfortunately, they've continued to climb really ever since that time. Since Thanksgiving, we've been averaging 45 to 50 patients in-house at any one time. And for a 200-bed hospital, you can do the math, that's almost a quarter of our beds are full of COVID patients on any given day. But throughout 2020, we've admitted over 800 patients with COVID to the hospital. We've had to make lots of changes in our normal daily processes to accommodate that. We've had to stop our elective surgeries periodically just to make sure we have enough rooms for the sick patients and enough staff to care for all of the patients. Currently, we still are not on a full normal surgery schedule. We are still facing increasing numbers of the COVID patients, and we're also having to battle issues with staffing. As we have a large number of staff that are out either with COVID or they have sick family members at home and they're unable to work because of that. But as we move into 2021, we are hopeful that along with the new vaccines, like Bangor said, we have to continue our social distancing and wearing masks and washing our hands constantly. We're hopeful that we will see fewer patients with COVID that are in the community and therefore in the hospital. Obviously, we're concerned about the patients and the long-term effects of COVID, since we really don't know what will happen to these patients in the long term. It's not just the patients that have COVID that are causing concern, though. I mean, across the country and also in our department, our emergency department here, we're seeing more and more patients that are coming in for alcohol and drug overdoses. We're seeing more victims of domestic violence that are coming in. And again, to echo Mayor Moore, we're seeing lots of patients with mental health issues. And I also worry about our children. I've got 2 teenagers at home, and I worry about how their social growth and maturation and development is going to be affected by not being able to be around their friends. They're not in the school building, and how will they be prepared for college? So even people who don't have COVID, this pandemic is obviously affecting. Now, I mentioned the vaccines, and I know that there are a lot of questions about that. I've gotten questions at the hospital frequently about when is the hospital going to provide vaccinations for the general public. So I wanted to give a little background on how the vaccines are distributed. And so they're being allocated by the federal government. So the government is basing the number of vaccines each state gets based on the state populations. And so they'll distribute vaccines to the state. The state then sends it out to the county health departments and hospitals. And so our hospital, Williamson Medical Center, was initially given 1,170 doses of the Pfizer vaccine a little over 3 weeks ago. But we have over 2,000 employees, so that really provided barely 50% of our staff with vaccines. Just end of last week, we were lucky to get an additional shipment of the second vaccine, the Moderna vaccine, and we just started using it on Saturday to vaccinate the rest of our staff. The CDC has put out guidance as to whom should receive the vaccine or the initial doses of the vaccine, and we are following these guidelines. So initially it was healthcare workers, essential workers, and community members older than 75 who are in this initial wave of people who are eligible to receive the vaccine. And as more vaccine becomes available, the shots will be made available to those with other health problems and then move into the younger, healthier age groups. But this is going to take several months. So even with the vaccine out now, we at the hospital, we still expect this pandemic to last really through May, June, at least. So this is not going away anytime soon. The health department, again, has been allocated some doses of the vaccine, and as Mayor Moore said, they're scheduling the highest risk community members to receive their vaccines. That process is available on their website, and you can go ahead and sign up for those appointments to get your vaccine when more shots become available. Unfortunately, since it's all done through the federal government, we do not know exactly when we will receive more vaccine doses. So I recommend everyone go ahead and getting on this wait list. So when the vaccines are available, they have an appointment set up. We also receive lots of questions about the safety of the vaccine. As of this morning, we've distributed over 1,200 doses at the hospital, and we've yet to have anyone who's had a significant adverse reaction to the shot. It does give you a sore arm. I had a sore arm when I got mine. I get my second dose tomorrow. We've had reports of people feeling just kind of achy and feeling like they have the flu for a couple of days, some low-grade fevers, but we've had no significant events at this point. Again, the shots have been shown to be very effective, 94 to 95% effective within 7 days of getting the second dose. So that's very promising. The biggest issue is getting enough people to get the vaccine. Projections show that 70 to 90% of the US population will need to take the vaccine before we reach the herd immunity threshold. And until that really happens, we must continue to wear masks and socially distance, all those things that I mentioned earlier to keep everyone safe. Getting vaccinated and wearing masks, those are the best things that we can do to help keep ourselves, our families, and our friends and other community members safe. And that's going to be the quickest way to stop this pandemic. I'll also mention that we've seen a rise in the number of mental health patients. That's really nothing new. We see those every day, but we're seeing more and more of those patients, and the primary care doctors are seeing more of those patients in their clinics as well. Mayor Moore created a panel in 2020 to discuss the mental health crisis in Franklin, and they put a group, or this group started the project Find Hope Franklin. That's been fantastic. It's provided a lot of resources and information on mental health issues, and it's helping citizens to manage their mental health. The ER is always there to help with that as well, but this Find Hope Franklin has been outstanding in helping providing resources to the community. And as the county continues to grow, Williamson Medical Center will continue to evolve and grow to meet the healthcare needs of the community. That's the mission of the hospital. And just in conjunction with the growth of the county, the hospital is continuing to grow. Over the last few months, we've welcomed Dr. Eric Sumner to our gastroenterology practice. We've expanded our surgical robotics program. And over the next 6 months, we'll be opening a new primary care clinic in Spring Hill with 2 new primary care doctors there. We're opening a new primary care clinic in Nolensville this month as well. In the next few months, we'll have a new neurologist that'll be starting with us. And the Bone and Joint Clinic has also opened a satellite location in Nolensville with plans for 2 additional locations across the county later this year. And exciting to me with my background in the emergency department is we're in the final planning stages to expand our emergency department, and we hope to start construction by the end of this year. All of this growth and all of these projects of the hospital will continue to help us meet the needs of the Williamson County citizens as we continue to grow. At the hospital, we're just constantly monitoring the needs of the community. And again, that's our mission of why we exist, is to serve Williamson County. So that's really all I had this morning. It's an exciting time to be at the hospital. We finally feel like there's a small light at the end of the tunnel. So again, I don't want everybody to think that as soon as you get the shot, this is going away. It's still going to take several months. So again, I implore everyone to continue to wash hands and distance as much as possible. And lastly, I want to thank all the healthcare workers who are putting their lives at risk every day by going to work. They are truly in the danger zone, and they're heroes to all of us.
Well, they certainly are heroes to all of us, and we're glad to hear that the vaccine is coming in and that you're able to vaccinate the entire staff at the hospital hopefully soon. And that is really supporting the staff. That was something that we saw a lot of in 2021 with people bringing meals and having campaigns to support healthcare workers. That extends throughout the hospital, not just those who are patient caregivers, but those who are doing the other things that help Williamson Medical Center operate, such as cafeteria or food service or hospitality and housekeeping. Talk a little bit about just how what that support meant to the team at Williamson Medical Center.
You're exactly right. It was great. Early on, we had church groups would show up in the parking lot at shift change. They'd be singing hymns and praying for everybody. There were lots of meals that were provided to staff, and that was all fantastic and very much appreciated by everyone at the hospital. And as you mentioned, the frontline workers get a lot of the credit of the nurses in the ICU and the emergency room staff. But like you said, we couldn't do it without everybody else, especially from our housekeepers who are cleaning these rooms, from our x-ray techs who are going into the rooms with these patients to take x-rays, or if they're going in to draw blood. It's a lot of people, and it's not just the ones that pop into your mind initially, but everybody at the hospital plays a very important role. It is really like a symphony where everybody has their role, and when they come together, it works very well. But we couldn't do it without everybody there.
Well, we appreciate you, and we appreciate the team at Williamson Medical Center. And thank you so much for being with us this morning. I think you've answered some of the questions that people had about the current status of COVID in our community and the vaccine accessibility. But we'll keep wearing our mask and washing our hands and using our hand sanitizer and staying away from people, except in a Zoom meeting if we can, to try to stay healthy. But thanks so much, and we'll see you soon in person, okay?
Thank you. Have a great day.
Have a great day. Okay, Matt Largent, you're up. So it's 2021. Everything's back to normal, right? It's just back to normal snap.
I think this is actually the 13th month of 2020.
I would agree with you. I would agree. It's just like don't you think a lot of people, I do think a lot of people just thought the new year's going to come and this is all just going to disappear. But
I don't
really,
think anybody thought that. I think we hope that,
okay.
but I mean, this is just a continuation, right? I mean, we just have to stay vigilant. It's really hard to stay vigilant since we've been vigilant for so long. We're working against human psychology, I think, to a degree, right? So, but what you said about hand sanitizer, masking, distancing, doing all those things, we have to do those things now to keep our economy healthy now and in the future, for sure.
So we're here this morning to talk about 2021, and I guess we have to talk, we've talked a little bit about 2020, but what's ahead in 2021 and how are we going to begin to rebound? And to what degree does Williamson County's economy need to rebound for this to feel a little more normal?
Right. Well, and I think you know, a healthy economy equals a healthy county. Those two things go hand in hand. And we've been so lucky that we've had great leadership for decades now that have understood and why it's important that this economy stay healthy so the community stay healthy. And we're really just building on the foundation that was laid back in the 70s and 80s. So that's important to say. I'd also like to start by echoing what Mayor Moore said about being so careful about what you post on social media. And really, whether you're posting to a group or you're posting individually, pick up the phone and call that person. I think that's really important. And I know, Mindy, you've done great work around civility. That's also something that we have to stay vigilant with. And we just have to learn to bring the temperature down. And it starts with every single thing we do when it comes to what we post online. So let's start with there. Why instead of posting that, pick up the phone and call somebody, especially if it's something that you know is a really difficult issue to talk about. So that's one. Secondly, I'll say, Mindy, thank you for having me this morning. Great questions that were submitted ahead of time by the people who were involved with Franklin Tomorrow. And I thought I'd just go through some of those questions and just answer those if that's okay. So I thought the first question, the two, they're really related. How do we get back to business as usual, given the pandemic will still be here for some time? We just heard from Dr. Russell, it's May or June, so that's certainly the case. And what are the strategies for Williamson County to remain as safe as possible from COVID while continuing to build momentum in creating and sustaining revenues for small business? Also incredibly important as we move forward. So I'll just start by a little bit of the going through 2020. As an organization, we were there from the beginning, helping to author the reopening guidelines with Franklin and Brentwood, advocating for businesses to open, whether you're essential or not, as long as you meet the safety criteria. That is really, really important, I believe. We helped vet some PPE suppliers, and we had some virtual and small in-person events, even had a drive-in movie event in the last year. Programming does kick off this month for us, for you as well, in Franklin Tomorrow. I think at the end of the day, businesses need customers, and customers need to remain healthy to sustain and grow those businesses. So we're encouraging people to shop local and shop safe and do those things at the same time. That's really important. So what are we doing to ease the financial burden and address health concerns of stress and instability that came up with Dr. Russell as well? And this was mentioned earlier. It's really the PPP, the Paycheck Protection Program, that we pushed heavy in 2020, that we're getting a second round now in 2021. We've got a program, it looks like the end of January, maybe the 27th at 11 a.m. with SBA. We're going to talk about exactly what that looks like for the second round of PPP funding. We're working on the day, we're working with chambers across the region to make sure we do that. But that, I think, is really important. And the big question is, if we know if you took the first time, you have to show a 25% drop in revenue to access the second round, but we don't know if that's true for everybody who applies. So we're all waiting for some guidance, but we're going to make sure we have SBA on the call with us and people can ask live questions to the program we do later this month. So with that in mind, one of the other questions about current economic thoughts and forecasts of growth. On January 21st, we're going to do an event called the Williamson Business Barometer, where we're going to talk about some of the results that came from a survey we put out in December. So I'd encourage people to go to our website, williamsonchamber.com, sign up for that event on the 21st. It's at 9 a.m. But I'll just share some high-level things about our economy. Right now, our unemployment rate's 3.3%. It's the lowest in Tennessee. That's great. We had 45 ribbon cuttings in 2020. That's down from 19, but that is actually one more than 2018. which again, I think is a good thing. Job growth is one of the most important things to pay attention to when it comes to the health of your economy. And our labor force actually grew by about 900 people during the pandemic. So that's a great sign too. I know Lori's going to talk a lot about housing statistics and how the housing market stayed not just stable, but actually has grown and increased in value in Williamson County. We know people are moving here. And, I think a lot of what happens in the future depends on remote working. What's the future of office space look like? How does that impact traffic? And is company recruitment going to turn into talent recruitment as more companies look to have remote work as a bigger part of what they do? Because I believe remote work will be an employee retention and attraction tool long term. I don't think offices go away, but I'm not sure they're occupied as much as they were pre-pandemic. I think COVID is an accelerator for trends, and we saw the remote work trend years ago. So that's really important. I think what's really important though, and this is, I'll kind of close as we go through some of these. One of the questions was about companies coming to the area, right? What new businesses are coming in 2021? We know that we're actively working a number of projects. I think the pipeline will get even busier in early 2021 as companies decide where they're going to allocate those resources long term. And there was a great example that happened late last year from a company out of Arizona, Landmark Recovery. It's a addiction center company headquartered in Arizona that actually ended up moving here sort of on their own. We work projects usually with consultants like Mitsubishi, and it's very formal. Where there's these 5 cities down to 2, make the visits, make the case, do the announcement, and it happens, and we introduce Mitsubishi to the community. But then there's companies like this that happen because people just want to be here. And that CEO was looking for a warm weather state, looking for a state without an income tax, looking for a place with great schools in Williamson County, and looking for a place that in his mind wasn't pursuing anti-business legislation, which is what happened in Phoenix. So that's a really interesting story. But I think what's important for us to know is that companies and individuals are looking to move here because of all the things that we enjoy. And it's important that we continue to build on the things that we enjoy, and we really take care in making sure that those things are still in place, because people move for the same reasons that we stay here. And that's why I think that Williamson County, from a business standpoint, has an incredibly bright future ahead of ourselves, especially with organizations like yours, many that are looking out for the vision for the future for this community.
Well, thank you, Matt. And you mentioned about people coming, and the mayor mentioned the hit that the hospitality industry has taken here in Williamson County, but that's big business here. And you, Williamson Inc. and yourself, you've had a great relationship with Visit Franklin and the Convention and Visitors Bureau. We're sad to know that Ellie Chen is leaving us to go to Madison, Wisconsin, but there's the things that make it special to a visitor make it special to those of us who live here. Those things are not just for visitors, right? I mean, they're assets to our entire community and amenities that we can all enjoy.
No, that's exactly right, Mindy. And whether it's the latest restaurant that just opened on Main Street or something that came into Nolensville or to Fairview, they're great for tourists, but for those businesses to be successful, they have to have residents too, right? So there's an ecosystem that supports those businesses that has to be here, and nothing's been hit harder in the pandemic than the hospitality industry. Hospitality, events, restaurants, those have all been hit incredibly hard from the pandemic. And we haven't had a lot of small businesses close in Williamson County, but that doesn't mean they haven't seen a big loss in revenue. So I think it's really important that residents step up and meet that demand that tourists were meeting, to make sure those places continue to serve our community. And one of the questions that was asked, Mindy, from the attendees was, how do we keep the uniqueness of Williamson County? And those uniqueness come from those small business owners, right? We don't want to become just a sprawling suburb like you've seen in Atlanta. What makes it unique is the open space and the parks, and what Franklin's done with Envision Franklin, and make sure that density stays in the 65 corridor, and we maintain the rural character east and west in our county. So I think it's really incumbent now for the residents to support those local businesses to make sure they're still here through the pandemic.
That's great. And those employees are important to our economy and to our unemployment rate as well. And so at 3.3, we'd love to see that even lower, right?
Well, we would. And I think too, that's the people who live in this community. We know a lot of people in hospitality who can't afford to live in our community commute from outside the area in. So it doesn't take into account those people that have lost their jobs at places that are here because the unemployment rate is higher in the surrounding areas. So, it's a little bit of misnomer, but it's important to keep in mind too. And we could talk again about affordable housing, another issue that came up and it came up big on our survey too. And we'll talk a lot about affordable housing at our event later this month with the Williamson County Association, later this year with WCR, and later this month in the Williamson Business Barometer on January 21st.
Great. Thank you so much, Matt, for your time this morning. And that segues so nicely into introducing Lori Lehman, who is the president of the Williamson County Association of Realtors, president of their board. And we welcome you this morning, Lori. It's great to have you.
Thank you, Mindy. Just want to tell a little story of how 2020 came, and that will be an example of what 2020 will look like. So with 2020, it was definitely turbulent with the pandemic hitting across the country. As that first wave hit of the COVID-19 in the spring, our market did slow down substantially, but we made a dramatic comeback just 2 months later. So with that comeback, that was from the buyers. Buyer activity was created because we had those low interest rates, and many buyers just wanted to secure better housing situations due to the pandemic. People working from home, as Matt spoke of, and children doing school from home. Maybe that floor plan's not the perfect floor plan anymore. So that was a need. Another thing that was something that as a realtor, maybe we didn't think about prior to COVID is, do we have high-speed internet access? That was a big reason why you may buy or sell. But with those buyers creeping up, that created a supply-demand problem. So in a typical market, a 6-month supply is normal. And right now on single family homes, we've got a 1-month supply, and we've got 1.8 condo supply. So that's what our market is showing right now as far as supply and demand. With the market, it continues to have that buyer demand. So we're going to need more properties available. So that is driving prices up. On these slides, you can see a few of the numbers here I've put together. Since then, we've got more accurate numbers that I'll read out here just a little bit. So compared to last year, overall, the median price increased 6.9%. And for a single family home, prices went up 7.7% compared to last year. Townhomes went up 4.6%. Something that is exciting is sellers received 99.3% of what they were asking for their property. So the housing market's strong here, and the housing market in 2020 proved to be incredibly resilient. Ended the year on a record high. As we look to 2021, signals suggest that buyer demand will remain elevated with a tight inventory, and will continue to invite multiple offers and higher prices across much of the housing inventory. Mortgage rates are supposed to stay low. So I'm excited about a 2020 in real estate and 2021.
It's always been a strong market here in Williamson County. Mm-hmm. And you mentioned something that I think that's interesting, is that maybe that perfect floor plan isn't the perfect floor plan for people anymore. How's the market? How are builders are they able to change and shift to meet what people are seeing as their future needs? Or do you think we'll see some type of new development in Williamson County?
Well, builders have changed the way they're building properties. The formal rooms went away a while back, and the formal dining rooms definitely went away, and home offices. But now home offices are a huge demand, and We're seeing a lot of people that were in very tight communities on the smaller lots moving out toward wanting more land when COVID hit. So that's another change in the market that we're seeing. They're wanting more land to get out in their yard and still be able to social distance. So that's another change. So supply land is hard to come by, so builders are struggling to give what buyers want. So
it's really interesting to look at that, and then to look at how the supply has been impacted. People are either in a moving mood, or they're ready to stay put, right? Because you're not seeing that turnover of existing homes. As it doesn't appear that you're seeing that turnover of existing homes as to create that supply in the market.
right. Well, again, the supply demand, we have definitely buyers there. So we just need more sellers that would like to sell. Builders are building as fast as they can. I don't have the exact number in front of me, but the building permits pulled this year are way above last year's number of permits pulled, and we're still a shortage of housing. And part of that is, like Matt said, this is a wonderful place to live. And with the education, entertainment, roads, healthcare, I mean, everybody wants to be here. So it's a good problem to have, everybody wanting to be here. So
People ask me if I'm from here, and I say no, but I got here as soon as I could, and I'm not going anywhere. So I think that's what people feel like once they get here. And we appreciate you, Lori, and we appreciate that update on a sector of our economy that stayed strong, but is also trying to find the way forward for 2021. So we really appreciate you and the Association of Realtors. How many members in the association?
a little over 3,000. So, and we're growing. So a lot of people are getting into real estate now. Some people may have lost their job and looking at real estate as a new career, which is exciting as well. So we're growing.
And those are all small business owners, right? Entrepreneurs.
Absolutely.
Thank you so much. I hope you have a great day and Happy New Year.
You too. Thank you.
Thanks so much, Lori. Okay, we're going to talk with Chris Whitney now and wrap up our program. And this is 2020 was an unbelievable year for your organization, One Gen Away, but you have experienced so much. Is it 10 years that you all are celebrating that you have been in this ministry, Chris?
Yeah, just over 10 years. I think we're coming into our 11th year this year. So our official 501c3 was 2013. So I guess we'll come up on our 8th year in May of this year, but we've been doing it for a couple of years before that through the church.
So, I mean, obviously, I personally know that the need that existed in 2020 was unseen before. And how do you feel as you head into 2021? Better prepared, concerned? What are your feelings?
That's a great question. And you've given me a lot of time to think about it. And I really don't feel like I have many better answers when you ask the question. Thankfully, we live in an amazing community. Lori and the Williamson County Association of Realtors and so many people, Patrick with Rotary, you with the Rotary clubs, we've had great support. As 20, we grew over 100% in 20, and the need was just overwhelming. So 21, there's a lot of questions. I think that we had so much money pumped in through the PPP, which, Matt was talking about, and then the CARES grant, which doesn't affect maybe a lot of y'all, but from a nonprofit world, the CARES grant was a big deal for a lot of us. And I think the couple concerns I have for us as nonprofits, I think sometimes the world around us doesn't realize that we do run as a business still. We still have budgets and all these other things that we have to just, right, Mindy? That's part of the deal. And so Matt, same thing, right? And I think with these CARES grants and things is, if a nonprofit was struggling, it's like there could be this false sense of security that we've got all this money now, but we don't know if money's coming federally, state in 21, donors, I mean, most nonprofits I know, churches, donors were great. They gave. It was an amazing year of giving as well. But will 2021 repeat that? And I think those are the unknowns. What I look at as a nonprofit, and then uh, having the doctor on was amazing because it helps us to um, understand that this is not ending anytime real soon. Unfortunately, I thought third quarter would probably be a really best case scenario. I mean, if we could really kind of get back to whatever the new normal is, probably more realistically it'd be fourth quarter. But in the world we deal in, some people will never recover if we're being honest, and I think that's what's alarming to me. And as Matt brought up, affordable housing, what does the demographic look like in Williamson County this year? What about 5 years from now? Who do we serve? Can they stay here? And I think for me, 21 hopefully will be a year of greater collaboration amongst nonprofits. And there's a couple things we're working on with Williamson Inc. and another project that we're working on that hopefully soon we'll be able to share about, that we're going to really work heavily on collaboration with all of our nonprofits, so that, and I think becoming a regional resource because of the resources that are in Williamson County, I think that's something we have to look at as nonprofits too.
Chris, you were talking about collaboration, and you all did a great job. I mean, any idea how in pounds or in total that you impacted or meals you provided in 2020?
Yeah, it was probably right around a little 4 million meals in 2020. So it's pretty amazing, staggering. I think just to relate to where we live in Williamson County, when COVID hit, we would do about 40 boxes, the big banana boxes of food. We would do about 40 a week. And in March, within a 2-week span, our team was able to pivot from 40 to 600 a week. And if you think about Williamson County, what's that looking like in the counties that touch us, the ones around us? And we dealt with some of those too, but those 600 were just literally Williamson County school system and Franklin Special.
And you're dealing in food, but the need exists. You deal with food, but you work with other nonprofits in our community, and talk about that quilt or that fabric that we have that has come together to cover Williamson County.
It's amazing. We obviously in some ways we're kind of the newer kid on the block in a lot of ways, but we work hand in hand with Mercy and Grace Works and the juvenile justice system, CASA, Bridges Domestic Violence Shelter. Pretty much anybody that's here that touches food, we try to work with them. The Franklin Police Department. We've been really, really fortunate to be in such a gracious, giving community, and the hearts of the nonprofits to serve together. I think that's really how we create a city that's not just an amazing place to live, which we all believe because we live here. But I told, and I'm sad about Ellie as well. I remember telling Ellie that I'd love for us to be known as that city that endorsed our nonprofits in such a way that we met the needs of all of our citizens, no matter if they were marginalized or the wealthiest of the wealthy, that we really were intentional about meeting every need. And I think that's what I love about the nonprofits, Mindy, is that we're very intentional about making sure everybody feels welcome and that they can live and survive and thrive in Franklin.
And you mentioned that you're going to have a partnership with Williamson Inc. and the Williamson County Association of Realtors was volunteer time for you all this year in your giveaways and in other ways, Rotary. But as a nonprofit leader and in what you do today, while money and financial donations support are important, what are other things? What's the most important thing that people could give to One Gen Away today, if above and beyond their financial support?
I mean, I think volunteering is obviously always a big deal, and especially in the counties that surround Williamson County. We'll have, I mean, I'm not kidding, we'll have 150 or 200. You've seen it in Franklin. We can have 150 to 200 volunteers, but I could go 20 minutes away to some parts of Nashville. I mean, literally 20 minutes away and have 40 volunteers. And once again, I think that and I understand that, but we need the surrounding counties to thrive. I think for us to have our viability too. I think once again, we're together, uniquely together. And I think volunteering, And the other thing is food donations. I mean, we're going through a lot of food, as you can well imagine. And I know we ask for food all the time, but I mean, things like cereal that are kind of a little higher end item, which are critical for us, is a really big donation. Non-perishable food items like that, rice and beans, things like that. I mean, just the simplistic things, but those are big for us because we're dealing with schools, and so school-age children. It's just hard for me to fathom that we have to deal. I mean, it is what it is. The Bible says, we'll have the poor with us always, but kids cannot go hungry in the Williamson County school system. It just can't happen. We can't be going a weekend without eating, and we can't have our elderly population making decisions between food and medicine. I just don't think that it can happen, but I think there needs to be a solution. And so we have several great food ministries here in town. Nolensville's got a food bank. We've got Graceworks. We've got all these great pantries in town. And now we've got a food bank in in Williamson County as well. So I think if people would continue to give food, it would be a great, great help for so many of us to meet the need.
I saw something that list recently about the kind of things to give to a food bank, to think beyond necessarily just macaroni and cheese or something like that. So what would be something that's maybe not on the EBT, so the SNAP dollars, or that those on low income assistance can't purchase, that is often requested from at One Genaway?
Yeah, like, toilet paper, paper towels, those things are critical. And something you and I talked about, Mindy, too, is people would be amazed how many people live in hotels here. I mean, they'd be shocked at the amount of families that are living in hotels. And not because they're moving here and need a place to stay for a couple months. I mean, that are homeless, basically. And so pop top cans, I know nobody thinks about that. And then Mindy, you and I have talked about, what about people that are lactose intolerant? What about people that have, need organic, gluten-free, organic, all those things. Just because someone is struggling for resources doesn't mean they shouldn't be able to have the resources that are necessary for their health and well-being. Mm-hmm. And I think that's the thing I'd like for people to think about. I think sometimes when we go buy for a food pantry or a food bank, we go, well, let's just buy the cheapest thing we can get and get the most of it, which I understand that, but we do deal with some special situations. And my wife, Elaine, is just really big about the pop top cans. Because if you're living in a hotel, you may not have a can opener and you need a way to heat up, something. So those are critical things. So those are all things that I think I'd love for people to be aware of when they're buying product. Because it's starting to pop up more and more that people with certain dietary needs that we need to help fill.
Well, and I appreciate your time so much, and that I love One Genaway and I support you. And I actually did something for our Rotary Club when we did our food drive. I did an order through Kroger and let them do the shopping. They pulled all the food off the shelves for me, and I was able to come with all those cans already bagged and ready to go. And thinking about it, that's something, if you want to do it, but you don't feel like you want to make that huge shop, those grocery stores are shopping for you, and they'll bag it and put it together. Yep. And you can drive straight out to you and you'll take it, right, Chris?
Yeah. Oh, we definitely will. And it's really an honor and a privilege to be on this today. And I thank you for bringing awareness to us as nonprofits. And I know you do, and you're a nonprofit, but I'm really grateful for this opportunity and this amazing community that we've lived in. And I'm looking at all my friends that are on this call, people that I've got to know, Matt and Lori, and I don't know Lori yet, but we do work a lot with the Williamson County Association of Realtors and Patrick, obviously with the Rotary. So you all make this happen, and that's what's so wonderful. And I think that 21 is going to be, I'm not going to lie, I try to be as honest. I think 21 is going to be a struggle for a while. Mm-hmm. But as Matt said, and Mayor Moore said, if we can be vigilant and stick together, we can get through the other side of this thing. And I think we'll all be better for it, when we get there.
And for organizations, for nonprofits like Franklin Tomorrow, but certainly for One Gen Away or others, people often give once or twice a year, but if you set up the continual giving and the reminder to give monthly, it's really not that hard to do. And so we would encourage people to look at nonprofits that you support, such as One Gen Away. We would love the support at Franklin Tomorrow so we can maintain our free programming. But it is a great way to show your support and be part of building this community, building us back up. And we're so excited to have you here this morning. Guys, anything else, Matt or Laura?
Yeah, let me just close by saying, I think 2020 was not really about building character. And I don't believe that you come out of tragedies necessarily stronger, but I do think 2020 was character revealing. And I think what's so special about this place is the fact that we do something different than other communities across the country. We work together. We respect and like each other, and we understand that we can't be successful as a community unless we're taking care of everybody. And I think that, it sounds a little cliche, but every time we have other cities come and visit Franklin and Williamson County, and we want to know, why is this place so special? It starts with the relationships that people on this call and across the community have that are all on the same team. We all understand we have the same mission, and that's to make this a great place for families, for business, for residents, for tourists. I mean, that again, I don't think we can take for granted how important that is to our community now and in the future.
Thanks. I totally agree. And Patrick, you can weigh in, but I mean, Matt, even when we go places in a group, whether it's through the destination trips that you take or the Vision City trips that Franklin Tomorrow takes, people are stunned to see how well we work together. And when we were pursuing the All America City designation with the city, at the end of the competition, one of the judges asked us, normally an organization like Franklin Tomorrow is born out of some crisis. What was the crisis that created Franklin Tomorrow? And we were fortunate to be able to say it wasn't a crisis. It was forward-thinking visionaries who saw that our community was a special place, and how could we build a fabric to keep it special. And so we are so glad to be part of this community, and we have a bright outlook for 2021 with Patrick as our board chair, and some new things and some old things planned that we are going to be announcing over the next couple of weeks. But we intend to undertake something like On the Table, but in a different format. And we'll be announcing that as we move forward. But thank you all so much. We've gone over our hour a little bit, but oh well, they're still with us. The next thing we have coming up for Franklin Tomorrow is on January 26th, and Matt will be with us again. We have Breakfast with the Mayors. This will be a virtual event, and we are excited to welcome Tennessee Economic Development Commissioner Bob Rolfe as our speaker. The mayors, specifically Mayor Ken Moore and Mayor Rogers Anderson, wanted us to invite the commissioner, and he is excited to come and speak to our group. So we're excited to have him. And Matt, we'll have you with us that morning too. But that'll be January 26th. We'll start at 7:45 a.m. We may even have a networking session before that. We're still working out the details on that. No coffee from Community Coffee though, unless you get your own pod, but it's good coffee. But thank you all so much for being with us this morning, and we'll see you all soon, if not before, on January 26th at Breakfast with the Mayors, and then again in February on the second Monday of the month. Have a great day, everybody.
Thank
Thanks.
you. Thank you. Bye-bye.